Our cases have decreased dramatically since we last spoke. We currently are caring for about 50 COVID patients in the hospital across our healthcare system. About half of those are active COVID patients who are requiring isolation, and about half are individuals who had COVID and are still recovering and unable to leave the hospital because of complications. So if you remember, about 3 months ago, we had 700 plus in the hospital, so that's significantly improved. We do continue to see the same trend that we've seen throughout the pandemic, is that the majority of the patients who are in the hospital were unvaccinated or under-vaccinated, meaning they'd not received that third dose of vaccine yet. And speaking of boosters, there's been some development since we last spoke. We've been getting a lot of questions about the CDC, their latest recommendation on an additional booster dose for certain populations, meaning that fourth dose of vaccine. And I certainly can understand that can be confusing or even alarming to some, that additional booster doses are currently recommended. What the FDA has approved is that individuals who are 50 years of age or older, or those who are immunosuppressed, and it's been at least 4 months since you received the first booster or the third dose, you've been approved for a second booster. So while the FDA has approved the fourth dose for those ages 50 and older, my professional opinion is that the fourth dose is really most beneficial for much older patients over the age of 65 and those with significant chronic medical conditions. And I think we should be prioritizing those individuals at this time. Vaccine supply is good. So if you're at higher risk and eligible, consider getting boosted or speak with your healthcare provider to determine if it's necessary. This added booster recommendation has led to some discussion on social media about the number of vaccine boosters people get, and some conversations related to what people are referring to as immune system exhaustion. And that's a belief or an idea that a person's T cells will somehow begin to wear down or not function as well after being exposed to a vaccine several times in close succession. There's really no evidence that a booster spaced 4 months apart would exhaust anyone's immune system. There's also some debate on whether a fourth dose is necessary if you've also received some degree of natural immunity from infection. My personal view on this is that if you've had COVID, I would consider that as having had 1 dose of vaccine. That approach has been taken in other parts of the world, but has not yet been backed in a widespread way in the United States. That's my personal view on how you should count having COVID in your vaccine total. So for example, if you've had 2 doses of vaccine and subsequently got Omicron COVID, I would consider that as having 3 doses of vaccine. We certainly need further studies to confirm how a natural infection correlates with the number of vaccine doses, and hopefully that will come, but we need to consider also, if you've had COVID, I would say, hey, that's 1 dose of vaccine if you're trying to do the math at home. And I think that's really hard for the public sometimes, because it seems like there's this whiplash among, recommendations for vaccination, and all these things are back and forth and back and forth. So we're trying to do this in a way that makes sense, that protects people, and it is anticipating what the next thing coming is. So we always try to do that. But I do think in the next few weeks we'll see some additional cases, but hopefully nothing like we saw in January. I think that we may get to a point where there's an annual COVID vaccine, at least for some people. I think we have to see, what the information and data shows, particularly around young people who've had COVID or had several doses of vaccine. Do they really need an annual vaccine? I think that remains unclear. To date, I don't know that they will, but we'll have to see. I think it's a different issue for those who have chronic medical issues or don't respond well to vaccines. Say someone who has cancer is getting chemotherapy, they're not going to respond to vaccine as well. And so they have to be thought of in a different way.